In America, 1 in 7 people has kidney disease, and 9 out of 10 of them don't know. Meaning, in this room, someone watching this video has their kidney failing from within, and sadly, they don't feel it. I'm Dr. Osama Ibrahim, a specialist in nephrology and hemodialysis, and what I'll say today could really make a difference for you. Let me tell you about Michael. Michael is 66 years old, a retiree from Texas. He walks every morning. He doesn't have diabetes or high blood pressure. He went to get routine tests because his health insurance required it. The doctor called him later and said, "Michael, your GFR is 28. Michael asked, "What does that mean?" He said, "It means you're in stage 3 of chronic kidney disease." Michael hung up and sat for 2 hours, unable to speak. How did this happen? How did this happen to me without any symptoms? This story isn't rare. The kidneys, and this will surprise many people, don't feel pain. They don't have enough pain receptors for you to feel it if there's a problem occurring inside. The truth is, the pain people feel during renal colic, which occurs in the kidney area, isn't actually pain in the kidney itself. It's usually pain in the ureter caused by stones. The kidney itself doesn't feel any pain, and that's exactly what makes it dangerous. The kidney works well even if only 25% of it is struggling, meaning if I removed both kidneys and left you with just one, you'd live a completely normal life. Now, if you had only a quarter of one kidney, would you feel anything? Almost nothing. It's very normal. Today, I'll tell you about 9 signs that appear a month and sometimes years before a crisis. They serve as an early warning for the onset of chronic renal failure. Then we'll get to the question everyone asks. If the kidney is damaged, can it return to normal function, or is there no hope? Stay with me until the end, because the answer will surprise you. The first sign is foamy urine. If you notice your urine is foaming, meaning small bubbles appear on the surface and the foam persists and stays there, this means there's protein in the urine. This is the first sign that the kidney is being affected and has started leaking protein. We've made a specific video about foamy urine, when it's dangerous, when it's normal, and what steps you should take as soon as you see something like this. I'll leave the link in the description or in the iCard that appears. It's a very important video that explains when to worry and when to see your doctor immediately. Let's continue. Protein in the urine is the first sign the kidney is being affected. For most people, when we review their history and ask if there was foamy urine, they say yes, but no one told them it was important. Tell your doctor during your follow-up that you want a urine albumin to creatinine ratio test. This is the most accurate test to show if the kidney is leaking protein even before it shows up in the urine and causes foam. Honestly, if you don't ask for it, no one will. The second sign is swelling around the eyes and in the extremities. The kidney is responsible for regulating water in the body. If it fails, water builds up. You'll mostly see it around the eyes in the morning and under the ankles at night. A patient tells me, "Doctor, I wake up with swollen eyelids and thought I was just sleeping on my face wrong." No, that's not sleeping wrong. That's a sign that the kidney is starting to be affected. Before I tell you the third sign, which will amaze you, if you like the video, I hope you'll hit like and subscribe to the channel, because that supports us in spreading content. Let's continue, and I'll tell you. Sign number 3, unusual fatigue. What's that? The kidney makes a hormone called erythropoietin, which tells bone marrow to make blood. If the kidney fails, blood drops and you get tired. Not normal fatigue, but fatigue even after enough sleep. Fatigue while sitting, tiredness without any reason. The problem is that this is sometimes diagnosed as depression or chronic fatigue. In fact, some people start taking medications like antidepressants to treat this problem. And the truth is, the reason is that your kidney has started to be affected. The fourth sign is waking up and going to the bathroom at night multiple times. What does that mean? If you start waking up more than once at night to urinate and that wasn't normal for you, pay attention. A healthy kidney concentrates urine at night so it lets you sleep. A tired kidney is the one that loses this ability. And many people say that this is due to age. But the truth is that nocturia, or waking up at night multiple times to go to the bathroom, could be the first sign that your kidney is starting to be affected. The fifth sign is leg cramps. The kidney regulates potassium, calcium, and magnesium. If it starts to weaken, potassium accumulates or decreases, and this causes very painful muscle cramps at night. It starts in one leg and ends in both. Most people take magnesium, but the pain persists because the problem isn't magnesium. It's the kidney itself and the minerals it regulates. Sign number 6, which is very strange, persistent itching or scratching without any cause or skin disease. If the kidney starts to lose its function, the toxins it used to filter accumulate in the blood, and some of them go to the skin. This is what causes persistent and annoying itching all over the body, and it increases significantly at night as well. As we said, regulates many minerals, including phosphorus. So high phosphorus due to kidney issues also causes persistent itching and scratching that doesn't respond to any allergy medications. If you have persistent scratching without any reason, please get a kidney function test. Sign number 7, a metallic taste in your mouth. What does that mean? As we agreed, the kidney filters toxins. When these toxins accumulate in the blood due to kidney issues, which we call uremia, this waste buildup in the blood causes a metallic taste in the mouth and an unpleasant odor. And many people start taking medications and things to improve the taste in their mouth or change the breath. But unfortunately, the problem is primarily in the kidney. And this isn't a stomach problem, it's an early warning from the kidneys. Sign number 8 is loss of appetite and nausea, especially in the morning. Uremia, or high waste levels in the blood, affects the digestive system. Its first signs are being unable to eat your breakfast. The smell and taste of food are very bad. Water has an unpleasant taste in your mouth. As soon as you smell the smell of food, you feel nausea and vomiting. If you have this sign, consult a kidney doctor immediately. Sign number 9 is shortness of breath. Despite the absence of any heart problems, if your heart tests are fine and you still find yourself panting, while doing simple effort, the kidney might be the cause, whether from anemia or fluid buildup in your body and lungs. Now, let's go back to the question that puzzles everyone. If, God forbid, all these things happen, can the kidney recover, or is there no hope? The answer depends on one very important reason, which is this problem acute or chronic? What does that mean? Is this kidney failure acute and temporary, or chronic kidney failure that will require continuous dialysis? Let me distinguish between them simply. Acute or temporary kidney failure happens when the kidney is suddenly injured, meaning severe dehydration, a certain medication and an overdose, a surgery where bleeding occurred, and many other things we could do a whole episode about. If you want to know them, write to me in the comments, and I'll make for you a full episode about the causes of temporary kidney failure. If we treat the cause, the kidney can return to normal. True, it won't be 100%, but it will recover. Chronic kidney failure happens when the kidney is gradually damaged over years. A diabetic patient, a hypertensive patient not taking meds, always has high sugar, high blood pressure, recurrent urinary tract infections, or many painkillers taken without medical supervision. If all these things combine and repeat over years, they unfortunately lead to chronic kidney failure. The only treatment for this is dialysis until we prepare the patient for a kidney transplant. Unfortunately, the kidney here never fully returns to normal. But what most people don't know is that we can stop this decline. We can also slow it down or delay the dialysis stage to the very end. Remember Michael, whom I told you about? Michael's problem was taking ibuprofen and painkillers for constant back pain in large amounts. When he stopped ibuprofen and followed a health plan for 6 months, managing his pressure and sugar, his GFR improved from 28 to 38. And this isn't a miracle. Science says that every 5-point improvement in GFR delays the dialysis stage for years, not months. If a loved one is told to just watch out and do routine tests to check on themselves, say no. Monitoring without a treatment plan is a total failure. Ask your doctor during your periodic checkup for a GFR and albumin-creatinine ratio test every 3 months. Always aim for your blood pressure not to exceed 130/80. Also, keep your sugar levels in check if you're diabetic. If you must take any medication, always review your prescriptions with a nephrologist. If you have high blood pressure, ask your doctor if you need to switch to ACE inhibitors or ARBs. So what should you do now? First, ask your doctor for the tests we mentioned. Number 2, completely stop any type of painkillers, especially the non-steroidal group. These drugs slowly and steadily burn out your kidneys. If you must take them for chronic physical pain, keep it to a minimum and consult a nephrologist. Thirdly, blood pressure medications. Diabetes medications must be taken regularly, consistently, and with follow-up. Always keep your pressure and sugar levels stable so your kidney lasts as long as possible. Lastly, excess protein strains the kidneys. Consuming large amounts of red meat increases the load on your kidney. Balance your diet and eat healthy food, and replace red protein with any white protein. Michael's GFR is now 38. It's not normal, but he's not heading for dialysis. He's the one who decided, after learning his GFR, not to wait for symptoms and chose to learn more. And you too, if you've stayed with me this far in the video, it means you're taking your health seriously. This is the most important decision you'll ever make. These 9 signs we discussed shouldn't scare you. They're a weapon. This knowledge will protect you if you follow it correctly. We made this video today with your well-being in mind. We hope you've done something good today too. Make it a habit. Like, share, and help others. I'll see you next week to check in and give you peace of mind. Take care. Don't forget to watch this video on foods that can cause kidney failure. It's a very important video that will show you many dangerous foods we eat every day. Goodbye.